Good. Wow, I'm still like surprised by like how much. Thank you.
Yeah.
I know I've been sitting a lot, like during the pandemic, working from home. I feel like I've always had like some issues. I've gone to see a chiropractor before, where I'd have like just lower back pain that I'd try to relieve, and I'd gotten some adjustments before, but it's not something that's really like gone away. I always feel like I'm always trying to stretch out my hip flexors and trying to see if that helps.
Does it feel tight in the groin?
Yeah.
Okay.
Yeah, I feel tightness more on my left side than on my right side.
Got it. Okay.
But yeah, definitely have that.
Where do you feel the tightness on your left side?
Just like in hip flexor, left groin.
Okay. How long has that been going on?
Gosh, I want to say it's like over 10 years, but it's never been like unbearable. But like once or twice a year, I'll feel like everything will get like super tight, and then I'm just like, oh, you know, I should really like do something about that.
When does it bother you more? Like what activities? What?
Yeah, I would say in the mornings. I often feel that stiffness. The more physical activity I do, like the better I usually am. But like I said, remote work, working from home, long hours in the seat, definitely hasn't helped.
Got it. And does it radiate down into your legs at all?
You know, maybe sometimes I'll feel it like a little bit
on your side,
on the side, but not all the way down to like a knee or anything.
And do you ever get any knee issues? I'm just kind of curious.
Sometimes, yeah, I feel it like just a little bit. Like I'll get some soreness if I go for like runs,
okay,
or jogging. Yeah, I'll feel it.
Yeah, try to go.
Okay.
Does that hurt?
Not too bad, but I feel it like when I'm coming up a little bit, like in this area.
Right here?
Yeah.
Okay. Is that typically where you feel it? Like kind of right here?
Yeah, that's typically where I feel some of the pain.
Okay. Okay, and come back up. It's at the very end that you feel.
Yeah, and then almost like a little bit like here in this area.
So this tells me if there's any inflammation in your spine, potential inflammation.
You know, mostly it's on my right hip.
Okay. Right there. You feel it's kind of sensitive there?
Yeah.
On the right side?
On the right side.
Yeah. That's right there.
Yeah.
Is it worse as I get further down? Here?
No. Actually.
More on the top?
More on the top.
Okay.
And like right there, yeah.
But you feel it worse in the morning when you wake up?
In the morning when I wake up, and then I like try to stretch a little bit, then it loosens up.
Okay.
But also when I'm sitting for a long time, that's when I definitely feel it more.
And it's always more towards the right side?
Yes.
Not really in the center?
Not really in the center.
Is that tender right here?
Yep.
Yep. Okay. Yeah. So I'm getting a reading here. So if we kind of just feel your skin. So in our technique, we really want to, not feel through like a sweater, but we want to kind of feel the texture of your skin. So if we kind of go down, there's like a pool of inflammation right here at this nerve root right here.
Yep.
It hurts, right? It gets sensitive as I get here.
Yeah, definitely feel that.
Yeah. That tender right here.
A little bit.
One more here. Probably more on the bottom.
Right there, yeah.
You have a couple problems over here. So one of the things is you're really worn away at your L5, right? I mean, you can see that how worn away that is. You do have a disc issue, and typically disc issues have been, they usually are worse earlier in the morning.
Yep.
Because your discs hydrate overnight. But if they hydrate and you have a disc problem, then it gets even worse and you have to kind of work it out. So I do think you have a disc problem, but I actually don't think that's the primary thing right now.
Yeah.
Just based off of kind of what you feel and also you kind of diving in, and then the last step when you come back up,
yeah,
you kind of feel that because your pelvis actually has to rock a certain way, right?
Right.
At that last moment when it rocks, it just feels off, like, it catches basically. That's a lot to do with the hip rotation. I'm sure they, we went over that.
Yeah.
But that hip rotation is going to be pretty crucial. What this is telling me in terms of the x-rays is it's rotated a certain direction. But I actually think it's rotated the other direction because it makes more sense with your symptoms. I will have to work out this component in terms of rotation, but the rocking forward and back is something that's, I want to test if that actually helps you a little bit more so.
Okay.
And then obviously you got the kick over here that we work on.
Yeah.
And then over here, your neck is straightening out. So usually there's a culprit over here, and that's why it's tender over here.
I mean, I had like one like bodyboarding accident like a long time ago where I felt like my head got pushed back, but I didn't have any like fractures or anything.
Oh, okay. You are wearing away into here, so at the back of these joints, it's kind of worn away. Not kind of, it is worn away on the back of these joints. It's actually kind of slip forward as well, so. Okay, you ready?
I think so.
All right, sounds good. Ready or not, here we go. So we're gonna lift this up like that, okay?
Okay.
And you're gonna feel a pop, but good. Not too bad, right?
Not too bad.
It's good. Okay. So this is your pelvis. So I'm gonna be shifting this up so it can kind of rock, but also out like that, okay?
Okay.
So I'm gonna torque that joint. Roll you over here a little bit. Okay. And set it in like that. Okay. So just relax here. Good. Sure. Okay.
Okay.
What do you feel?
It feels easier. Like I feel like, I don't know, like I feel like I'm like, you know, almost like bracing for the thing and then it doesn't come.
Yeah, I know. That's what happens a lot. Yeah. So it doesn't catch as much at the very end?
No.
In terms of pain?
No, I don't feel that.
It is a little bit different than what I'm seeing in the x-ray, so I want to make sure I got it right on the dot. Yeah?
Yeah, I don't really feel it as much.
Okay, cool. Okay, so yours always do a 5-part analysis.
Yeah.
So yeah, usually we kind of really look at the x-rays, but one of the myths of our technique is that we just purely rely on x-rays, but it's really based off of your movement, your symptoms, all that stuff. So it's kind of a thinking game in terms of that too.
Yeah.
So yours is one of the kind of more rare cases where it's actually kind of the opposite of what we're seeing on the x-rays as well.
Really?
Not the opposite, I shouldn't say that, because there's still a lot of components that are helpful in the x-rays that clue me into that. But it is a different vector than we would just apply just purely looking at the x-rays. So we always want to correlate the x-rays to the patient, right?
Yep.
Okay, so how this is basically kinked that way, we're going to basically torque it and set it in that way, okay?
Okay.
So do this, and just relax here. I'm gonna relax your shoulders down, and I'm gonna set this in. Okay. Different, I know.
Different, yeah.
But you can kind of feel how it lets me set it more accurately.
Yeah.
Yeah.
Look at that. So, wow, I'm still like surprised by like how much that even just, because I like cross a leg over and you twist, and I have to do that to just feel like I'm gonna get like some relief, but wow.
You know, you said you went to other chiropractors.
Yeah.
Getting the vector exactly right is really important in our technique. We want to make sure that it's exactly right. Because if you kind of miss some of the vector or some of the three-dimensional vector, then it can still catch into that joint or can still be kind of unstable in that vector. So that's what I meant. Like, I want to make sure I got it exactly right.
Yeah, and I feel like maybe last time what they did is they like, you know, like they grab like my right leg and they like give that quick like pull. But But
so we're not trying to get pops here. We're trying to actually
set it, because I didn't feel like I got tons of relief from that. I'm just really surprised because I'm like waiting for it to catch and just feel that like tightness at the top, and I just didn't. So yeah, thank you.
Yeah, my pleasure. That's our job.